I'm Professor Martin Connor. I'm the founder and CEO of Healthcare Logic, a recently formed company on the Gold Coast in Australia. Healthcare Logic arose after 20 years of experience working in public hospitals in 5 different countries and realising that there were common problems to them all. For 15 years we worked in teams at government, health authority, primary care and hospital level to try and improve care for patients, and in particular how the organisations and their processes work. The last 5 years in particular we've been focused on one part of that problem, which is what information do clinical teams need to improve with their work. And it was very interesting. In 2013 we undertook some research and we asked senior doctors what information they had automatically available to help them improve their processes. And we expected the answer to be not very much, but it wasn't. The answer was none at all. And that's really the gap that we've been trying to fill since. And today we think we've achieved a significant step forward in being able to automatically deliver patient-level data with high frequency that's relevant to clinical teams, that takes away the burden of looking for and organising information and enables people to make better decisions more easily. Healthcare Logic has a number of different partnerships which make it the company it is. In part we've got an intellectual property partnership with Griffith University, we have a research and development partnership with Bond University, and we are partnered in perpetuity with the Gold Coast Hospital and Health Service and consider ourselves a part of the Gold Coast Health family. We also have significant investment from both private investors and public investors. We also have significant granting from the federal government in Australia and the Queensland State Government, which has helped us to improve our research and development capability to really answer the problems that the clinical teams face on a day-by-day basis. We've been focused on solving the problem of the information hospital executives and clinical teams need to improve their processes for 5 years now. And over that time we've invested between $8 and $10 million of research and development spend, and we now have a team of 20 people with 11 engineers focused on answering this problem for public hospitals worldwide. The software we've developed previously is currently being used in over 50 hospitals across Queensland. Our new platform, and we're very excited about its potential and the initial reception has been extremely positive, has just been deployed at the Gold Coast Health Service, the large tertiary facility at Gold Coast University Hospital and Robina Hospital in the south of the city. We believe high-performing companies recruit talent and talent alone, so we're very passionate about recruiting both for technical ability but also relationships and people who get on well and who are happy and positive in the workplace. And we're also very proud that we're a diverse company as well, so we're 40% female, which is very unusual in the tech sector, and we also represent 11 countries from around the world. Healthcare Logic's a mission-based company. We're passionate about public healthcare. We believe healthcare is a human right and not a commodity. We think in public health systems, care should be available to all. We know that there are scarce resources, but those scarce resources must be distributed as equitably as possible, so that access is not a question of the ability to pay, but a question of clinical need. We know that that vocationally drives public health professionals all over the world, but those professionals haven't had the information they've needed to support that mission, and that's what we want to try and provide.